A hockey shot is an example of a third-class lever. A hockey shot involves movement of the entire body. Every shot has a preparation phase. Although a shot is taken from the upper body, a lot of the power comes from the lower. To produce a powerful shot, the knees have to be bent. This involves flexion of the knees as well as the hips. When the knee bends, the origin is the ischial tuberosity as it remains stationary. The insertion is the posterior part of the medial condyle of the tibia. The primary movers are the hamstring muscles, biceps femoris, semitendinosus, and semimembranosus. The synergists are the popliteus, gastrocnemius, gracilis, and sartorius. Lastly, the antagonists are the quadriceps, vastus lateralis, vastus intermedius, and vastus medialis. The hip flexors are also primary movers in the bending of the knees to achieve a slightly squatted position. A crucial part of taking a shot is the weight shift from the back leg to the front leg. When pulling the puck back, all of the weight should be shifted to the back leg, putting pressure on the calf and flexing the back knee. This also puts pressure on the external oblique muscle. When the player moves the puck to shoot, that weight is lifted to the front leg, putting pressure on the front calf and flexing the front knee while extending the back knee, sometimes elevating the foot off the ground. Rotation of the hip joints allows this weight shift. The whole body opens up during the follow-through of the shot. This rotation is permitted by the lower back muscles as well as the rotation of the hip joint and aided by the obliques. The upper body is what holds the stick and actually produces the shot. When bringing the puck back, the lower trapezius suppresses the scapula and deltoid muscle of the arm on the lower end of the stick. The deltoid, trapezius, and pectorals of that side of the body are the prime movers in bringing the puck back and forth. As the scapula depresses, there is the extension of the elbow on that same arm. While this is happening, the other arm on the top of the stick is doing the exact opposite by having the elbow flex and the scapula and deltoid muscles slightly elevate. This movement puts pressure on the stick to get a nice flex when shooting the puck. While the lower and upper body are creating the power of the shot, the wrists are creating the movement of the stick blade. The wrists are primarily in the flicking action of the puck, which is why this is called a wrist shot. The top hand does most of the work. When bringing the puck back, the bottom hand wrist extends while the top hand wrist flexes. When the shot is taken, the bottom hand wrist flexes and the top hand wrist extends. This all happens very quickly. The phalanges are in a constant state of flexion as they provide a firm grip on the stick. The ulna and humerus act as the origin and flexion and extension of the wrist. A very important part of finishing a shot is the follow-through, which involves pronation of the lower wrist when following through. When shooting, supination of the wrist is what opens the blade of the stick, which lifts the puck off the ice. Once the puck is lifted, pronation of that lower wrist provides accuracy of the shot. The shooter actually points the blade of the stick to the part of the net that they want the puck to go. This is all from pronation and supination of the wrist joint.